We're going to head to Washington, D.C., where we have Dr. Anthony Fauci speaking right now on the ongoing coronavirus outbreak.
Because we want to make sure people don't get confused that getting a vaccine into a phase 1 trial within a 3-month period, you need at least 3 to 4 months to determine if it's safe and whether it induces the kind of response that you would predict would be protective. Once you do that, you graduate to a much larger trial. The N of the number of people in the phase 1 trial is 45. When you go to a phase 2 trial, you're talking about hundreds, if not thousands of individuals to determine efficacy. That is a trial that we would have to conduct in those countries and those areas where there's active transmission. That itself, even at rocket speed, would take at least an additional 6 to 8 months. So when you're talking about the availability of a vaccine, even to scale it up, you're talking about a year to a year and a half. Now, you shouldn't be discouraged by that, because it is certainly conceivable that this issue with this coronavirus will go well beyond this season into next season. So a vaccine may not solve the problems of the next couple of months, but it certainly would be an important tool that we would have, and we'll keep you posted on that. Secondly, and finally, the issue of therapeutic interventions. There are a number of candidates that we are now looking at that have shown some suggestion, either in vitro, in an animal model, or some empiric trials that were done during the MERS outbreak. One of these, and there are several that we're considering, is called remdesivir, which is a nucleotide analog that is produced by Gilead. Today, as I speak, there are 2 major clinical trials going on in China, which are randomized, controlled trials, which means that we will get an answer whether or not it works or doesn't work, I think, within a reasonable period of time. An identical copy of that trial is now being implemented in Nebraska with our colleagues who are taking care of the individuals who were taken from the Diamond Princess and brought back here, in addition to our colleagues in Japan. So I'm optimistic that we will at least get an answer. If we do have a therapy, that really is a game changer, because then we could do something from the standpoint of intervention for those who are sick. So hopefully I'll get the opportunity in the future to continue to update on these interventions. Thank you. I'd like to introduce Dr. Kadlec.
Dr. Fauci, thank you very much, and good afternoon, everyone. ASPR is providing unprecedented operational and logistical support to the State Department to repatriate approximately 1,100 Americans from China and from the Diamond Princess cruise ship in Japan. We are pleased that the passengers evacuated from China have completed their 14-day quarantine and have returned to their homes and families safely. Passengers evacuated from the Diamond Princess are in the process of completing their 14-day quarantine at 2 DoD installations, one in California and one in Texas. Medical professionals from our National Disaster Medical System and CDC are continually monitoring the health of these passengers. Any passengers who show signs of any illness are moved off the DoD facility and tested for this virus. Passengers who are tested positive for this coronavirus cannot stay on the military installations, and these patients are being transported safely to our network of special pathogen treatment centers, such as the University of Nebraska Medical Center, as part of our aggressive containment posture. These individuals are being placed in these facilities for quarantine and isolation purposes only. An intensive level of medical care is not typically needed by most of these individuals. At these centers, the patients who develop this infection can participate in the clinical trial that Dr. Fauci described with remdesivir. We are honored to have helped NIH to arrange that clinical trial within this special network of treatment centers. In addition, our Biomedical Advanced Research Development Authority, BARDA, is working with Regeneron to develop 2 possible treatments, and with Janssen and Johnson & Johnson to screen existing and investigational treatments and compounds to identify any that have potential use in treating coronavirus. And with Janssen and Sanofi to develop vaccines using vaccine technology that the HHS supported for pandemic influenza vaccines. We're reviewing hundreds of proposals for additional therapeutics and vaccines, and in particular diagnostics that can be used in hospital and clinical labs or doctors' offices. We're also prepared to support CDC and Department of Homeland Security at designated military installations where Americans returning to the U.S. on commercial flights can be quarantined based on their travel history. The most recent location to receive such a traveler is the naval base at Ventura County, Point Mugu, where one American is currently completing quarantine. Any quarantine at any of these military installations would not have any symptoms or a positive test result. Quarantine is based solely on their travel history that places them at high risk for possible exposure. Their health is continually monitored, and they're transferred safely to medical facilities for testing and treatment if any symptoms develop. It is now my pleasure to introduce Dr. Stephen Hahn from the FDA.
Thank you, Dr. Kadlec. And thank you for the opportunity to update you today on FDA's coronavirus activities. The FDA plays an essential role in overseeing our nation's medical products as part of our vital mission to protect and promote public health, including during public health emergencies. The FDA is an active partner in the novel coronavirus response, working closely with our government and public health partners across the U.S. Department of Health and Human Services, as well as our international counterparts. Our work is multifaceted, focusing on actively facilitating efforts to diagnose, treat, and prevent the disease, surveilling the medical product supply chain for potential shortages or disruptions, and helping to mitigate such impacts as necessary, and leveraging the full breadth of our public health tools as we oversee the safety and quality of FDA-regulated products for American patients and consumers. I'm happy to answer questions about FDA's activities, but I'll provide a few updates. First of all, the supply chain. FDA is keenly aware that the outbreak will likely affect the medical product supply chain, including potential disruptions to supply or shortages of critical medical products in the U.S. We are proactively reaching out to hundreds of medical product manufacturers to gather information about the supply chain. First, it's important to note that FDA is not aware of any medical product shortages at this time. We are, however, monitoring several products that might be at risk, particularly personal protective equipment, but we do not have any manufacturer shortages to report. Please be assured, if a potential shortage or disruption of medical products is identified by the FDA, we will use all of our available tools to react swiftly and mitigate the impact to U.S. patients and healthcare professionals. And we will take steps to quickly share that information with the public. With respect to inspections, for February and March, FDA has identified approximately 100 scheduled inspections in China, the vast majority of which are routine surveillance inspections. Those inspections are just postponed at this time and will be conducted at a later date. It's important to remember that these delayed routine surveillance inspections can happen at any time during the year. And while inspections in China are delayed secondary to the State Department travel advisory, we will send investigators to other parts of the world to ensure we are on schedule for our planned inspections for the year. Also would like to remind everyone that the inspections are just one tool that FDA can use to monitor compliance and to help prevent products that do not meet FDA standards for entering the U.S. marketplace. This process has a number of layers in place and is not solely reliant on boots-on-the-ground inspections. Overall, this remains an evolving and very dynamic issue that we will vigilantly monitor. We are committed to continuing to communicate with the public as we have further updates. Thank you.
Great. Thank you, Dr. Hahn. At this point, why don't we open it up for questions? Yes, here. If you could just wait for the microphone so the TV cameras can hear your question.
Thank you, Secretary Arthur. I'm Olivia Zhang with China's Taixing Media. My first question is, as China's coronavirus cases seems to be contained, while there are other countries like Italy, Japan, or South Korea seems expanding, I wonder, are you considering loosening the travel restrictions regarding foreigners with travel history from China while considering imposing travel restrictions with, travel histories regarding the above three countries? And also, I noticed that you were still referring the COVID-19 as China coronavirus. Well, I think WHO changed this to COVID-19 because they think the China coronavirus might lead to xenophobia or racism. Do you think it's proper to still refer it to China coronavirus? Thanks.
So we intend to keep our travel restrictions with regard to China in place at the moment. The the virus is still spreading in China. We're still having hundreds of case reports per day. If that's capturing all of the information, we're still seeing dozens or more fatalities reported per day. We certainly hope that China is able to engage in effective containment measures to slow the spread of this virus down, but there's nothing at this point that would indicate a change in our posture towards our aggressive containment measures with regard to travel in China. It's important, though, to remember we've been very moderated and titrated in those travel measures. They simply are based on 14 days, which is the maximum predicted incubation period. And so an individual who has been in China for the previous 14 days, who is a foreign national, would not be permitted to enter the United States, and an American or permanent resident would be permitted to return to the United States, of course, but asked to home isolate during the completion of a 14-day period outside of China. That is not a ban. That is a temporary restriction in line with the public health measures that we're taking. So we've tried to be very respectful towards travel. And of course, those restrictions are not based on other than American and permanent resident versus non-Americans, really as a matter of focusing our resources. They're not based on the ethnicity of an individual or anything else, because as you mentioned, it is important that we not engage in any, that people not believe that because of somebody's ethnicity, they are more likely to have this disease or not. Our criteria are all based on travel in affected areas and warning people about travel in infected areas based on the epidemiology and the evidence. So, Brianna, did you have?
You've been listening to U.S. government officials give a coronavirus update, addressing concerns over travel restrictions, vaccine testing, also the potential for shortages involving medical supply equipment.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.